I am gonna do it right now.
Knock knock. Hello, can I come in?
Yes, please come in.
My name's Harrison. I'm gonna be your nurse for the day. Can I get your name and date of birth?
My name is Ann Bullock, and my birthday is 99XX.
Ann Bullock, 99XX, and I do see that on the EMR. And I'm also gonna confirm with the patient's wristband. Ann Bullock, 99XX, and then MRN 102001, 102001, checks out. All right, Ann, and I do notice that you have an allergy band. Do you have any allergies?
Yes, I have allergies to Ativan and Sulfa.
Ativan and Sulfa, and I also do see that here on the EMR. So what happens when you take Ativan and Sulfa?
I just get really red and itchy and short of breath. It's just not a good experience for me.
Okay, so we'll make sure you don't have any of those medications today.
Thank you so much.
Do you have any, by chance, any allergies to like shellfish, iodine, or latex?
No, I don't actually.
Perfect. So the CNA did come in and we did do a bladder scan on you, and it turns out you have about like 900 milliliters of urine in your bladder.
Oh goodness.
Are you experiencing any pain?
Yeah, I have a lot of pain right now. It's like 9 out of 10, and I haven't been able to pee since yesterday.
9 out of 10?
Yeah.
Okay. And where's that pain at?
It's like in my lower abdominal area. Like I think it's my bladder, but just down there.
Okay. Awesome. So I'll do a little bit of assessment, but it also looks like you do have an order for an indwelling urinary catheter.
What is that?
So pretty much it's going to be this little tube that goes in your urethra up into your bladder, and it's going to just kind of sit in your bladder, and it's going to allow you to eliminate any of that retaining urine that you have.
Oh, okay. Thank you.
Yeah. Do you have any questions about that?
Yeah, is it gonna hurt?
It will be a little bit uncomfortable, but once you're able to eliminate that retaining urine, your abdomen pain is gonna feel a lot better. Okay?
Oh, okay. Whatever will work. I'm good with that.
Okay. And we also do have an order for a urinary specimen, so we'll take that towards the end. Okay?
Okay.
All right. So first thing, let me just. Is it okay if I move your table and your tray?
Oh, please.
And then the CNA told me that she came in earlier and she did some peri-care and bed bath. Is that correct?
Yeah, I got a whole body bath.
Perfect. Is it okay if I raise your bed up a little?
Oh, please.
And then is it okay if I lay you flat?
Uh-huh.
So like I said, the first thing I'm going to do is a quick little abdomen assessment, okay?
Oh, okay. Feel free to take a look.
Is it okay if I lower some of the covers?
Oh, please. Go ahead.
And then is it okay if I lift your gown up a little bit?
Oh, go ahead.
Okay, so I do note that there is some abdominal distension, confirming that there probably is some retaining urine in your bladder, okay?
Oh, goodness.
So if it's good with you, we're just going to go ahead and go on with the urinary catheter, okay?
Okay, I consent. That's awesome.
Okay, perfect. All right, let me just get a few, and then so before we do that, are you familiar with like the frog position?
No, what is that?
So it's pretty much, it's a combination of you kind of like bending your knees and moving your legs outward. It just helps us facilitate the insertion of the Foley catheter, okay?
Okay.
So I'm gonna help you with one.
Thank you.
Go like this, other one like this. You comfortable there?
I'm very comfortable. Thank you for asking.
Okay, perfect. Awesome, so now just let me get a few things set up and then we'll get going, okay?
Sounds good.
Can you put his head back? And I guess I said yeah, you can just verbalize. Make sure you take sips of Wait, what was that then? You mean like the same thing?
Yeah.
Not yet. Now we have to verify.
Oh, yeah.
I was like, whoa, whoa,
X-ray.
whoa.
X-ray.
They're the gastric contents first.
Gastric contents, because then you want to make sure it's actually in place. before you start doing stuff.
Oh. I guess that doesn't make sense. I think we
How do you know you're gonna get gastric? That's the first food in the
well,
first
you
place.
don't, so it's kind of interesting.
I'm saying.
And you might get like
We don't have to worry. We don't have to worry. It's really good.
What do we know?
We're just choosing to keep peace over here. Which step is first? Gastric, like checking for the gastric pH, or verifying X-ray?
So, when you call to verified X-ray, do they immediately magically show up at your room?
No.
Correct. So, call them first and say, hey, I'm just placing an NG tube. I have an order for an X-ray to verify placement. And get them on the way, and then verify with your gastric content, right? As long as your patient is stable and they're not showing any signs of, you know, any airway obstruction, yes, anything else like that. So get X-ray, nip in the butts, and then check your content. Is the way that I have always done it.
Right.
In terms of, I mean, like, I don't do these. I work L&D, right? We don't do this.
Yeah.
All right, and so the next thing I'm gonna do is I'm just gonna place this straight down. The purpose for this is to help us maintain that sterile field. And with doing that, we want to make sure that you keep your legs and feet as still as possible, just so we can maintain that sterility. Okay.
Okay, sounds great to me.
So, but yeah, that strip goes in, or you can get the gastric content first. No. Use this syringe.
That's
I was like, what are you doing?
I haven't practiced that part yet.
Oh.
Which the blue.
No, not the blue. That was the end of the blue. And then this one. Yeah. Yeah, so stay down there. Oh no, I missed it. And the pH matches, and then you can grab the box to the pH things. Okay, so the pH is at a level 3, which indicates that I need to get that.
Oh, I did.
Oh my god, you know what I need to do? I need to find I'm gonna tell Professor Matthews
You have Friday.
for a farm test. I gotta be
It's way up again.
at least a 71. I do have this.
Yeah, that's good.
I need at least a 71. So I mean the B health, I'm still feel like I'm not safe. There's hope.
All right, and so the next thing that we have to do is, even though it did get cleaned by the CNA, I'm just gonna go in with some iodine swabs and just make sure that it's sterile. Okay.
Okay.
And so this is going to require me to place my hand around your vagina. Is that okay?
Oh yes, go ahead.
Check this. I was like, wait, what? I didn't have time to think about it.
All right, and so I'm going to go ahead with that. Okay.
Okay.
So first one I'm going to do is I'm going to do the outer inside.
You don't need to find that piece.
Yeah, you do. It's kind of important for the section. Very good. Why?
And then I'm going to do the inner inside.
But you have to honestly take the dogs out. Like,
Oh, that's
I'll like.
And then I'm going to go straight down the midline.
You're not hitting. Oh no, I can still do. It's kangaroo.
Wait, really? Wait, are you doing that? No, it's not.
All right, and so the next part is going to be the insertion of that catheter. Okay, so when I tell you to, you want to make sure and take a deep breath. Okay.
Okay, that sounds good.
Like, I'm.
But no one. I only do it one time.
Oh, shoot. Maybe I don't.
All right, you ready?
Yes, I'm ready.
1, 2, 3. Deep breath.
Taking a deep breath.
Deep breath, deep breath, deep breath. All right, I see a flash of urine, so I'm gonna go in 2 more inches. 2. I'm going to hold it here. I'm gonna insert my 5 milliliters of sterile water. Okay. Next thing I'm gonna do is I'm going to confirm the placement with just a slight little tug until I meet resistance. Okay. And I'm also going to attach this to the patient's leg. And I do notice that there is flow. So Anne, how are you feeling?
I'm feeling a lot better actually. Once that got in and it started to flow, I think the pressure really just started to go away.
Okay, good.
Yeah. So thank you so much.
Next thing I'm going to do is I'm going to attach this to an immovable part of the bed.
What?
Right there. Make sure that there's no kinks or anything within the line. Let me cover you up a little bit, Anne, and then I'm going to clean up, and then we'll take that sample, okay?
Okay, that sounds like a good plan.
Leg, and I'm gonna put your legs, help you put your legs down, okay?
Oh, thank you. That feels so much better.
That's what you do.
Okay. So on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain ever, where would you rate that pain?
Now I'm at like a 4. That feels
4?
a lot better.
Awesome. So yeah, that's good, and hopefully with more time and more drainage of that retaining urine, you will feel a little bit better.
Thank you,
So
sir.
like I mentioned earlier, you did have an order for a urine specimen, so I'm gonna go ahead and take that, okay?
Okay.
Procedure. This, thank you. Oh, yep, I would have. Before article placement, I'm having facial trauma. What is it? Oh, deviated septum.
All right, and with this, I'm gonna place the patient's label as well as with my information, date, time, and initials. And does this look correct to you?
That does look correct to me. Thank you.
Awesome. So we're gonna send that down to lab and, okay. So just let me finish cleaning up here. And then, so you said your pain's about out of 4?
Yeah, I said yes. 4 out
Okay,
of 10.
awesome.
It's getting lower.
Awesome. So I am gonna lower you down. Is that all right?
Oh, please.
While I do this, just a quick few little education tips. So with this urinary catheter, you do have a Foley bag that collects this urine. So with this bag, we want to make sure that you keep the bag below your waist at all times. This is to prevent any potential backflow that could potentially cause a UTI, okay?
Oh, okay. That doesn't sound very good. I'll do that.
No. And then I'm also going to hand you this call light. And so with this call light, just make sure that you, whenever you want to ambulate or anything like that, that you just give us a call. That way we can help you with that because we don't want you pulling out that catheter or anything, okay?
Okay, I'll make sure to call you.
Okay. So where do you want to keep that bag at all times?
You said that I should keep it below my waist, right?
Correct.
Okay.
All right, I'm just gonna finish cleaning up, give you all your stuff back, and then I'll be on my way, okay?
Okay.
Do you have any last questions?
I don't think so. You did a great job. Thank you.
Thank you.
What?
And then, do you want your head raised at all?
Oh, yes, I do. I also have, I want to read the New Testament, I think.
Of course. Tell
Thank
me
you
when.
so
Tell me
much.
when, okay?
Oh, you know what? I think that's perfect.
Okay, awesome.
Thanks.
Let me get you your stuff back. All right, and you have any last questions before I go?
No, I don't think I have any questions. Thank
All right,
you.
perfect. So once I leave, I'm gonna go document my findings. The patient tolerated the procedure, the pain before and after, my assessment of the patient, the characteristics of the urine, and yeah. All right, and thank you.
Goodbye.